Welcome to this launch of the MECC Moments website and this Lunch and Learn webinar. My name's Steve Peters and I'm the Cheshire Merseyside Population Health Workforce Programme Lead for the CHAMPS Public Health Collaborative. Unfortunately, Dr. Rory McGill's not able to be with us today due to unforeseen circumstances, so I'll be leading the webinar. We have got Rory doing a video cast for us later in the month, where he's going to talk about some behaviour change stuff. So we'll share that with you all when that arrives. So as you can see on the slide, there's a hashtag MECC Moments. Please feel free to tweet about that, and also there's the website there. But I'll make sure you get that in the chat later on. So just a couple of things in terms of housekeeping for today. We've got a large number of people joining on the event, so microphones and cameras will be automatically disabled. If you could please post your comments and any questions in the chat function, we're going to use that for our Q&A. We will try and answer questions live as much as we can, but we are going to produce a frequently asked questions document, which you'll all be sent following the webinar. And obviously, as I said, please feel free to tweet, and hashtag MECC Moments is our hashtag. So just a brief vision of the agenda. Obviously, I'm giving you a brief introduction. Then we're going to just look at a quick reminder of our basic MECC principles. We'll have an overview of the refreshed MECC Moments website and a demonstration of the MECC Moments service directory actually live from the website. Then we'll follow that with a Q&A via the chat function. And as I say, any questions not answered, we'll get in an FAQ document that we'll send out following the event. So what do we mean by making every contact count? The NHS's definition of MECC is there. I won't read it out for you. I'll let you have a minute to read it. So it's an important time for us to come together to talk about MECC. Obviously, post the pandemic, MECC, which perhaps took a little bit of a beating during that period, is now back on the radar. We've got all of our 18 trusts in Cheshire and Merseyside now signed up to the NHS Prevention Pledge and committed to engaging with MECC again. All of our 9 places across Cheshire and Merseyside are committed to supporting the development of MECC in their places. And hopefully what I'd like to do is to make sure that we're making a connection between all colleagues who are delivering MECC to make sure that we're sharing ideas and good practice. We've obviously got financial pressures on the system, which means we need to be more joined up and efficient with time and resources. So the better we can share our ideas and good practice, the better it will be. Obviously, social determinants have become a much greater priority for us. The work of the sort of Marmot team in producing Altogether Fairer. There's an increase in inequality, which is leading to increased risks of unhealthy behaviours. So MECC is becoming more and more important all the time. So just a reminder of what MECC is. Well, it isn't a standalone initiative, but it's part of our day-to-day interaction with people that can ultimately help them to change their the health behaviour. And it's a tool to enable staff and volunteers to deliver their day-to-day work in prevention, personalised care, core 20+5 and anchor institutions, reducing health inequalities through Altogether Fairer, using brief conversations to help people change their behaviour and guide them to services that can support them. Health and care professionals are in a unique position as they're perceived as sort of trusted advisors, you know, with doctors, nurses, teachers, policemen, firemen. They're all the sort of people who are perceived as trusted professionals, and we're very much part of that agenda. There's also really strong evidence for making changes to unhealthy behaviour. So that evidence is clear and unequivocal, both personally, but also in terms of the cost to the NHS and the healthcare sector. Also, there's no one person who's the right or wrong messenger, as long as the person gets the message across and supports the opportunity to interact with patients, residents and service users. The opportunity we've got is huge. I was speaking to a meeting this morning, and obviously with 18 trusts, 9 places, and all the wider public health workforce engaged in MECC, there's a huge amount of people who can make a huge amount of difference to people out there in the system. So I just wanted to look a little bit at the work that's led to this relaunch. Prior to starting, I carried out a SWOT analysis of the current MECC provision in Cheshire and Merseyside. MECC was originally developed in 2018, primarily aimed at NHS staff. Obviously, during the pandemic, capacity for MECC was severely impacted by COVID-19 right across Cheshire and Merseyside. So the challenge has been to find out who's doing what with MECC, and beyond the scope of my current program, there's a lot of work that I think needs to be done to really dig deep into MECC and to find out who was trained in 2018, who's still able to deliver, and who of the people who've been trained are actually going out there and delivering MECC. So I focused on the tool for professionals that MECC Moments website is. So it helps people to deliver MECC or MECC training and enables people to have access to a service guide that users can be pointed in the right direction to get the services they need at a place level. There's also been some development of a MECC for mental health training program through the Royal Society of Public Health. We were on a webinar in July, of which 56 people attended from 32 different organisations across Cheshire and Merseyside. And then a couple of weeks ago, Joe McCulloch from NHSE and I did a round table event, again, just to try and get a picture of what's happening with MECC across the Northwest. And obviously we contributed to that with our ICS footprint. HEE have also been looking at MECC resources and making sure that they're suitable for clients with learning disabilities and autism. And also with the Altogether Active strategy across Cheshire and Merseyside, we're developing a MECC for physical activity, and that's linked to some colleagues in the North East and Yorkshire who are doing some similar work. But again, what we're trying to do is to make sure that our MECC is aligned and joined up to the things that we need to do day to day. So as I say, this is the relaunch of the MECC Moments website, and it's a Cheshire and Merseyside tool to support professionals delivering MECC and/or MECC training, but updated to reflect the needs of MECC moving forwards. And I'd also like to remind our colleagues who've joined us from outside of our ICS that you're very welcome, and please get in touch to talk about how we can help you develop your programs beyond our own ICS. And I'm all for sharing our good practice. So the program focus has been on MECC Moments website, and as I say, it's a tool for professionals delivering MECC or MECC training. The refresh was possible within the current architecture of the website, so we didn't have to change the design of the website. We just had to change the narrative. I've been really supported in this by my project support officer Laura Clark, who's done a fantastic job, but also by colleagues across the 9 places who've helped update the service directory. We've also included additional elements that weren't there in 2018, linked to the sort of Marmot work and the emerging cost of living crisis. So when you see the website, the service directory is a little bit different from how you might have seen it previously if you've previously used MECC Moments. It also enables you to run a MECC campaign yourself. So for organisations who are just starting on their MECC journey, this will be an excellent tool to help you with that. So it's designed to be easily accessible and hands-on for sort of MECC leads in an organisation. The toolkit gives you everything you need to plan your campaign and start making every contact count. But knowing that the team at Champs are here to support you, and we'll be on hand to help you out when you need it. Inside the toolkit, you'll find facts and figures behind the health challenges that we want to tackle, and it's perfect for grabbing people's attention. There's a clear explanation of the main MECC messages and hints and tips on finding support and focusing your time to make sure that you're using that time efficiently to drive the project forward. There's also helping identifying different audiences in your organisation and a list of the channels that you may want to use for your campaign. There's an overview of our ready-made resources, and the links are in that the site, as well as advice on how to make your own if you need, and also advice on how to evaluate and celebrate your achievements. So by the time you reach the end, you should be all set to take MECC forward across your organisation and start to really make a difference. So the evaluation toolkit is a big part of the programme of prevention, and it's essential to provide evidence of progress to sort of line managers and senior leadership teams within your organisations. So the quick guide on how to evaluate MECC has been produced to support a consistent approach to measuring impact across Cheshire and Merseyside, and that will enable us to give that sort of ICS level picture. So reporting can be shared with other departments within your organisation and at board level to gain support and ownership for local MECC programmes of work. So if you want further information on the training toolkit, please contact me. And basically the training is really important to MECC. For people to actually have the confidence to go out and deliver MECC, they need to be well trained and have that confidence to deliver, and to deliver clear and consistent messages, and also to be able to signpost their sort of their clients or service users to the appropriate resources. Previously, there was a funded training program that's no longer available, but the HEE e-learning for health MECC module is really easy to access online and very sort of user friendly, and that can be used to support your organisation in developing a local approach. But I'd also encourage you to look at who was trained previously and who'd been delivering MECC on your behalf. And I know there's a lot of good work going on in the local authorities and some of the trusts already. So it'd be great to make sure we've got that consistent quality approach. So the main update, obviously we've updated the service directory with the help of the local authority public health teams, and we've included the social determinants around emerging cost of living crisis, food support. So when we show you the directory shortly, you'll see how that's been demonstrated. We've also included housing support and employment support, and these were things that came out of the Marmot workshops that were run around this time last year. So we've tried to align our MECC Moments resource to include those issues that quite often are putting people under pressure and ultimately leading to their unhealthy behaviours. We're also in discussion with colleagues within CHAMPS about how we can make the service information available in a more public forum, because obviously MECC Moments is very much a professional website. So we're looking at how we can make that available in a sort of public facing way, possibly linked to Be Kind to Your Mind, which is a public facing resource that is available. That's sort of watch this space, and we'll let you know how that progresses. So what are the next steps then? It's really important that you understand your target audience and identify who your stakeholders are, so that your campaign can be aimed specifically at them, and that will ultimately get more buy-in. Once you develop your campaign to suit your target market, then you can train your teams to be confident using MECC and MECC conversations to use in their day-to-day interaction with people. Then we would like you to sort of promote the use of the MECC Moments website for your teams, and ultimately it's a tool to help them deliver their work in a more easily and efficient manner. And MECC Moments is very mobile and tablet user friendly, as well as on your laptop or PC. So all the functionality that's available on a desktop is available on a tablet or a mobile. And then finally, we're going to be developing a community of practice for people delivering MECC, so we can share best practice and learn from those each other to embed MECC into our everyday working. So thank you very much for your time. Now let's have a look at the website. So I'm going to stop presenting, and my colleague Laura is going to pull up the website for us. Also, please feel free to use the chat function to make any comments or to ask any questions as we go along. So what I'd like to look at is a couple of examples. We've tried to pull out some things that we think you'd like to see in just an example. And previously MECC Moments was very sort of service led, and I've tried to make it much more place led. Because that means then that the information is not relying on the CHAMP support team to keep it up to date. It'll be locally led, and we'll just need to manage the links. So I'd like to start off by Laura's going to select Wirral as a place for our first example. So as you see, there's a drop-down box, and then we're going to look at social and welfare. So previously, a lot of the things that we've pulled out in the social determinants are now separately listed, but this shows you some of the services that that we're offering, not necessarily all through the local authority, but just useful resources that can help people with their sort of health and well-being or information. Or I know there's a really strong social justice offer within Wirral. So if people are concerned about legal issues but don't necessarily have the access to a solicitor, etc., there's a really strong offer in that place. So the next example, we're going to go to Cheshire and Western Chester. And they've got a really good example of how food support is articulated within Cheshire, Western Chester. So once you've searched, just remember to press the go button. So there you've got the three food support offers within Cheshire, Western Chester. So it'd be really easy for a client to be directed to those in a MECC conversation, just with a little search on the MECC Moments website. Then our next example is St Helens. And we're going to look at drug and alcohol. So again, looking at the different offers across the footprint within St Helens. So anybody being directed to those would have direct access, either looking at their website or through the phone numbers, and all of those can be shared sort of by email with the person looking at the MECC website with their clients. And then the last little one we're going to look at is Warrington, and it's the physical activity, and then we'll also look at the mental wellbeing offer as well for Warrington. So again, it links you back into some of the services that are being provided. Fit to Tackle, that's linked into the rugby league. Then Livewire is the physical activity provider within Warrington. So all of those things are ways in which people can be directed to physical activity programs. And currently we're working with the Altogether Active strategy to look at how we can actually get some information in here about just generally being more active and the benefits of that. But a lot of those, if you followed those through to the websites, would give you that sort of level of information. Then finally, what Laura's going to show us, and we didn't rehearse this, but I'm going to ask her anyway, is some of the useful links under the resources. So again, what we've tried to do is to provide opportunities to look at some of the perhaps more cross ICS area activities, ways in which you can link into those. So if you can just scroll down. So again, we've tried to list them by subject area rather than just having a random list. So hopefully that's giving you a little bit of insight into the website. And Laura, could you just show us again perhaps how you access the toolkits? So if you go back to the home page, and so the evaluation toolkit is within that resources tab, as is the training toolkit. And then again, if you're trying to sell MECC within your organization, under resources, there's some good success stories. So if you can just show us some of the success stories, Laura, please. So just some examples of how different organizations have started to get involved. And this is a little bit of good news story. We'll be sharing good practice. I know a number of colleagues who are from NHS trusts who we've been engaged with are starting to get some really good stuff going within their places with MECC. And obviously we'll keep the news stories and the success stories updated. So please, if you do have any good news stories or news you'd like to share with us about how your campaign is going, please get in touch. And then I suppose the last little one, Laura, is about just having a quick look at the campaign toolkit. So again, we won't read it out, but there's a lot of different resources. If you just scroll down and show us the examples of some of the media that you can download. Some of the posters are editable, so you can put your own information in there. There's web banners, graphics for social media, all the sort of things that you want to run a local campaign. And the last one there, the lifestyle advice, is like a printable Z card for that you can share with members of the public. Again, you know, you might be able to adapt that and put your logos in it. But again, that's a really good resource, mainly around the sort of healthy behaviours rather than the social determinants, because it's a resource that was available previously. But we will look at you know, perhaps some general advice around some of the social determinant type elements. So thanks, Laura, for sharing that. So what I'd like to do now is to just open up the sort of chat function, and Laura's going to read out some of the questions for me, and we'll see if we can try our best to answer those for you.
Thanks, Steve. So far we've had a couple of questions about how do providers update their details on the website, or how do they share information with us to be put onto the MECC Moments website?
Within the presentation, I talked about it just come to me in the first instance. In terms of making changes to local information, that would be through the local information. So if it's related to the MECC Moments website itself, then you would come to us. But if it's about local services, the contact would probably be through the information on that website, or potentially we've got a operational sort of MECC lead in each of the 9 places. So I'll have a quick chat with them about whether they're happy for their information to be shared on the website. But if not, we'll come to us and we'll direct that. So in our FAQs, we'll have all the contact details that you'll need for that.
Thank you. Next we have, could there possibly be another tab added for cost of living focus, where we could share information on people struggling with energy bills?
Yeah, absolutely. We have changed the sort of service directory to include some of the things around that, and definitely we'd like to develop that cost of living element. Some of the elements of it around you know, food support, employment, housing advice, cold homes, etc., is on there already, but very much we want to keep MECC Moments as relevant and up to date as we can. So we can definitely add in another tab, and I'll contact the local authority MECC leads to see what the local authority is doing on that front. But if anybody's got any resources that they're aware of, then please let us have those, and we'll include those within the website, because it's all about this being the tool that people can use to help making every contact count conversations as easy for them as possible.
Thanks. Rachel's asked, have we developed a generic MECC training that can be adapted?
We haven't, but HEE through the e-learning for health MECC training has recently been updated. I did that MECC training about a year ago, and I found it really easy. And at that time, I was sort of new to public health, and so I found it quite easy to do. A lot of the people who are trained already with MECC will be able to deliver MECC. But also we've got our MECC for mental health offer that potentially people can be trained through that and then deliver the wider elements of MECC, because although the MECC for mental health program is specific, the MECC element of a lot of these other things is consistent. So how you deliver the MECC conversation, the use of sort of behavioral change models, the COM-B model that some of you may be familiar with. But if I'm happy to have a conversation outside of the webinar about that.
Thank you. Helen, one of our colleagues in the Southwest, has asked about how we rolled out the training and content, and is there anyone they can talk to within our team to roll this out in the Southwest?
Yeah, I think talk to me in the first instance. We can certainly have a chat about that. We had a MECC lead who's one of my colleagues who's not engaged with MECC anymore, but certainly we can give you an insight into how we rolled out MECC in 2018 across the system.
Thanks. Mike Oliver's asked, have we got any examples, whether recent or any time since MECC's been launched, where a MECC moment has taken place, resulting in a member of the public following advice or signposting and being able to access the service and make changes to their health?
I think we have. I can't name it off the top of my head, but I will look through our good news stories and see what we can do. One of the sort of side benefits to the MECC training was that actually of the people trained to deliver MECC, 65% of them actually improved their own health behaviours. So in terms of staff and organisations and your teams, actually training people in MECC has actually helped to reduce your staff's unhealthy behaviours and hopefully reduce sickness, absence, etc. Lots of facts and figures when you look at MECC moments about the background of MECC and those sort of detailed sort of USPs of MECC in terms of the cost savings to the system, etc.
Thank you. The other questions that are coming up in the chat seem to be around some confusion about the Live Well and MECC website. But here, one of our colleagues, Jane Wood, and also David Pearson can support with any queries that you might have regarding Live Well.
Okay.
Is there any other questions?
Live Well, I believe, is a more public-facing website. MECC Moments is really aimed as a tool for professionals delivering training to colleagues so they can deliver MECC, or actually for people delivering MECC themselves. So it's a sort of in business parlance, it's a business to business resource, whereas the things like the Happy Hearts and the Live Well sites are aimed at members of the public, where MECC Moments isn't aimed at members of the public, it's aimed at professional staff delivering MECC or MECC training. We'll clarify that in our FAQs.
Thanks, Steve. Just going back through the chat now, I can't see any other questions. If anyone else does have any questions, please pop them in the chat.
So just while you're thinking about that, hopefully you've got some new information out of today. Hopefully you've been able to get a cup of tea or a cup of coffee and eat your sandwich while you've been listening. It's really good to see the number of people who registered for this this event, and I'm sorry if you're expecting to see Dr. Rory McGill and that's why you came, but we will be having a future session with Rory to develop behaviour change, and we might also be able to talk to some of the colleagues in Cheshire Merseyside who are involved in the Northwest Behaviour Change Academy. So hopefully that'll be a good resource for people moving forward.
Okay, another question here from one of our guests, Gus. Can members of the public join in with MECC?
In terms of can voluntary services organisations, for example, deliver MECC? Yeah, anybody can be trained to deliver MECC. It doesn't have to be a sort of blue uniform or local authority staff type resource. I know our colleague Debbie in Warrington has delivered some really good training across a range of organisations. So as well as local authority staff, they've trained voluntary sector staff. Some local authorities have trained library staff as well, because they're quite often in regular contact with members of the public. So MECC isn't just about clinicians. It can be everybody. As I said in the slide earlier, there's no right or wrong person to give that message. It could be that if you've got some knowledge around how you can change your behaviour and why you should, and you're talking to a neighbour or a friend or a mate at the football club or sat next to you at the footy match, there's no reason why you can't have that brief conversation about any of the challenges or issues that we're faced with in our sort of health and care world.
Another question from our colleague Liz. How do you find out who's been trained in MECC previously in your area?
I've got a list of all the people who were trained originally, so I might be able to help you with that. It's not something we've initially focused on because the program that Laura and I run is only an 18-month program, and it only became 18 months about a month ago. So we've really focused on making sure that this MECC Moments resource is available and fit for purpose. But our sort of next step linked to the community of practice will be helping people to identify who in their organisation was trained. Obviously, we've got the challenge of sort of making sure that we're adhering to data protection, but ultimately we will be contacting people who were previously trained to try and find out who's still active or interested in becoming training. It might be that a refresher for people who were previously trained, but obviously they haven't used it for 2 years because of the pandemic. We might be able to facilitate that for you. But if you email any specifics, we'll try our best to resolve that for you.
Thanks. A question from our colleague Neil, who's a learning mentor within a secondary school, saying that they have a lot of contact with families, and would it be worth their staff doing the MECC training?
Absolutely, definitely, yes. That sort of trusted advisor hat that we talked about earlier doesn't have to be somebody with a medical background or as a clinician. It's anybody who has the opportunity to have that brief conversation with somebody. That's an opportunity to make a difference to somebody's life. And I spoke to a colleague a while ago about reducing harm from alcohol, and it was a lady who's was saying that sometimes if people don't know how to get somebody into an acute setting, they don't do anything. Where actually you don't need to know how to get them to an acute setting. You might just have a brief conversation with them, and that may change the way they think about how much they drink. From a personal perspective, I have a very good friend who was having some real mental health issues, and he knocked on my door one morning, in a really distressed state, and I just sat him down, got him a cup of tea, and had a chat with him. I'm not a trained counsellor, but I think just talking to somebody about issues that are bothering them, or are giving them problems, then we can all be doing that. And actually having the training, certainly the Making Every Contact Count training, really gives you that confidence and almost permission to have those types of conversations. And obviously there's other specific training around zero suicide and other elements, but I think the generic Making Every Contact Count e-learning is certainly good. And I know I spoke to a social prescribing manager recently, and they were saying that all their new social prescriber staffs it's a prerequisite that they do the that MECC online training, and that's helping them with their conversations with their clients.
Thank you. Danielle has asked, will we be doing any train the trainer sessions to grow the MECC trainer workforce?
I think that Daniel, that's something we need to look at in terms of you know, when we see who's already been trained, how many trainers there are currently, and I know that there'll be new MECC for mental health trainers who could potentially deliver MECC training as well. But if you've got a specific example or specific challenge, please contact me, and we can have a discussion about it. The biggest issue is there isn't the budget to deliver that sort of activity that was previously. It may be that within your own service or organisation you've got some budget to do that, then we can perhaps look at that. And one of our local authorities was commissioned in 2018 to deliver the MECC trainer training, so it could be that we can make a connection between you and them, and then that's an arrangement between you to get the training that you want delivered.
Thank you. Val has asked, where can we get more information on the MECC for mental health?
I will put in our FAQs information on the contact details from Nelly Arujo from the MECC for Mental Health programme. I know that they had an offer for training for people, but I know they've sort of filled that capacity and have a waiting list, and that's mainly been linked to the training grant that was part of that offer. But if people want the training without the training grant, then potentially that's a conversation you can have with the Royal Society of Public Health who are delivering that training.
Thank you. Rachel's just commented saying that they're still looking for MECC for mental health trainers. So if that is something that anyone is interested in.
Yeah, we'll put you in touch with Nelly.
A colleague Ian has asked, could this be part of supporting students in higher education?
Yeah, absolutely. I think that particularly if you've got students who are in sort of healthcare related programs, them doing MECC training before they actually get into a work setting would be great, because they're then arriving on site with that skill set. Whereas if they're only having to pick that up once they get a job in the healthcare sector, then obviously that's something else they have to do as part of their training. So I'm very keen to work with our HEIs to make sure that their students, either in nursing or public health, are able to access this training. And that is a conversation we have sort of started. So watch this space.
Thanks, Steve. So we've had quite a few questions about whether or not there would be a cost to MECC training.
It depends. The e-learning for health modules are free and readily accessible. If you wanted bespoke face-to-face training, that's something you'd need to identify a provider and cost out. But certainly if you get engaged with the MECC for mental health training, there's no cost to that. It's just if you wanted a trainer to come and deliver face-to-face training, that you'd obviously have to pay for that. It wouldn't be paying champs because we're not in a position to deliver that, but we can make a connection with potential training offers that you could take up. So it would depend on how you wanted to roll the training out. If you've already had people in your organisation that are part of that Cascade Train the Trainer setup that was established in 2018, or if you've got people who are trainer trained, then you know, providing you can get them released from their day job, then there's no reason why they couldn't deliver training for you.
Thank you. Gus has asked a specific question about the LD and autism meetings. Would these be open to public or organisations like the autism hubs?
It's not a meeting as such, it's a resource that HEE have devised, so it's some guidelines. It's come out of Lancashire and South Cumbria ICS, where the point was raised that actually the current MECC resources weren't necessarily fit for purpose for people dealing with clients who have learning disabilities or autism. I can share the paper with you. We can share that as part of the resource. That was only launched, I think, last week, the final version of that. And I think it's just some guidelines at the moment with the intention to, follow the recommendations of that in terms of modifying resources to make sure they are suitable and fit for purpose. But the report is in the public domain, so we can share that with you.
Thank you. There's also been some comments about whether this aligns with MECC.
MECC is a resource that some other areas have used and is available to any local authority within the Northwest that was funded by OHID back in the day. In 2018, for Cheshire and Merseyside, the decision was made to develop MECC Moments. So MECC is a similar process, but it relies very much on having somebody to keep that updated. Whereas what we've tried to do is make the link to ensure that sort of local information is available. Certainly, if you Google MECC, we don't have MECC in Cheshire and Merseyside. If you look at MECC, I know they use it in Yorkshire and Humber and some other other places around the country, but I think that if you look at MECC Moments, you'll see what a comprehensive resource that is, and we don't have the capacity to do a parallel MECC link because it would sort of be duplication, in my humble opinion.
Thank you. A question from colleague Mike Oliver. Is there any feedback from people such as the wider health workforce who've been asked to use MECC as they go about their day jobs? How have they found it, and do they enjoy being asked to use MECC Moments, or has there been any resistance?
That's something that was discussed at a meeting yesterday. So I've got a meeting coming up with two colleagues who look after social care workforce from a workforce development perspective. It's not research that's been done yet, but I think will be. The relaunch of MECC Moments hopefully will lead to a bigger push for MECC being used outside of just NHS settings. And as I said previously, MECC is about enabling people to have those conversations in their day-to-day work. So it's not something extra that they have to do. It's just enabling. It gives some people some skills, perhaps different skills, to help those day-to-day conversations that ultimately will improve the people that they're talking to's healthy behaviour and ultimately make a difference to their lives. But it is research that we plan to carry out.
Thanks, Steve. I think that is all of the questions from the chat captured.
Okay, so that's sort of bringing us to the end of our lunch and learn session. Hopefully you've enjoyed yourselves. We will be sending you an evaluation document just so you can give us your thoughts, and we'll also make sure we're sharing all the information on how to access the MECC website, and we will share the slides with you as well. And also the session's been recorded, so it'll be available to colleagues who weren't able to attend today. So it'll be a resource that's available to people in the future. So thanks very much for your time. It's been great to see you, even though I've not really seen you because your cameras have been off. But hopefully you've gained a little bit of time back to get a cup of tea before your next meeting. So thanks very much for your time, and let's go out there and make every contact count.